This is St. George's, the capital city of Grenada, Carriacou, and Petite, Martinique. As with many small societies, the issue of mental health is very much still taboo. Why do you think it's easier for Grenadians to say someone is possessed or it's demons, witchcraft, obia, as opposed to facing the reality that a loved one or someone they might know, that person has a diagnosis of mental illness?
Mental illness by itself carries such a stigma that affects not only the patient with the illness, but the household. And as such, persons are more willing to accept it, and they will tell you it's been in the Bible. The Bible talks about demons and spirits and fighting these powers. So they are more willing to see it that way, out of lack of ignorance and if you want to say cultural, out of ignorance, sorry, and culturally, over the years, this has been the way it was seen, and in other countries of the world, they will have similar ways in which they describe the illnesses. Now, we are, unlike the physical illnesses which we all experience throughout our lives, these only affect persons at certain ages, and not everyone will experience it. And so the way in which it presents itself leads to that, to some extent, leads to that thought of witchcraft.
When you find yourself in a challenging situation, you have to blame somebody, right? It's very easy to blame the devil. It's very easy to blame somebody else and say, somebody do something to my daughter. Than it is to ask yourself, what is really going on here and how can I help? Because in mental illness, very often, when you ask yourself, how can I help? You're at a loss, you don't know. So the ease with which I find people rush to say it's obia or it's the devil and so on, is part of their own reaction to their own impotence, you know? I mean, when a man finds himself suddenly impotent, it's not that he getting old, you know, somebody doing something. And he will not accept that the ordinary process of life brings you to stages of impotence at some point.
Well, years ago, when we look at where mental health, you see, mental illness comes under mental health. Just like you have health and you have sick, you have mental health and you have mental illness. So when somebody is sick and they're diagnosed with cancer, you don't say it's the devil who did this and it's obia and whatnot. They run to the oncologist, they get a pathway for treatment. It could be herbal therapy or traditional medicine, and they work with a treatment. The same should be for mental illness. However, in small societies where you have spiritual and superstition and all those levels of beliefs at play, it becomes a challenge to just highlight or identify mental illness as it should be. An illness of the mind, right? An illness of the mind, and that's different from an illness of the spirit. So when people marry the two, it's because it's opinionated. It's not founded on science.
It all has to do with education, Sarana. Knowledge about the field, about the area we are speaking about. Okay. I don't think there has been over the years enough emphasis on mental illness, mental health, and that kind of thing. You know, that area has been taboo for many years, and it was not spoken about much. We did not have many professionals in the area. You know, I remember when I was a little boy growing up, you know, and you hear somebody is mentally ill, the first thing you would think, oh, somebody did that person, some obia or something, and they're totally mad, and then they send them up to the mental hospital, and that was it, and there wasn't any really good treatment plan or any real good treatment methods, most of the times the person was just medicated, and some of those psychotic drugs were actually very dangerous. In fact, some of them are actually banned right now. They're no longer in use.
I think it is easy for people to believe because we have to understand the culture. I think first of all it has to do with our culture. We have grown up in a culture where once things are not going our way, it is always easy to conclude that somebody is trying to stop us and somebody is in our blood. So most of the times, persons who've had what you would call disappointments, or they might have had some obstacles in their way, it is very easy for them to conclude that somebody's hand is in their blood. And we also have to understand where it came from, because most people, based on who they are, they try to tell people that the thing is not natural because there are so many things that associated with what we call witchcraft and obia. A simple thing like a frog. If people see a frog jump in their house, it's not strange for a frog to jump into your house, and the time you jump into your house. So people conclude that it has to do with witchcraft. Fowls, for example, it is also associated with that because you hear stories about fowls. So when a fowl wants to lay, that fowl will, anywhere that fowl will lay. If you get a chance on your bed, it will just fly into your house. And so I know of an individual who literally strangled a hen because the hen came into the house because it was black. And there are also colors that are associated with that. Because it was black, he held it in his neck and strangled the fowl, thinking it is somebody who is trying to do him. So a lot has to do with the culture and what people were fed with. Based on that, instead of pausing to determine what the problem is, they have already concluded. And mind you, there are a number of persons who are very good at poisoning persons in trying to make them believe that it has to do with witchcraft or obia.
Have you had to deal with exorcism? I know that's a term used in the Catholic Church. And how do you know the difference between a mental illness as opposed to someone being demon possessed and you have to do?
The Catholic Church functions with two things, faith and reason. We believe that these two things are equally important to the experience of God. It is God who has given us reason, and it is God. Faith is always a gift of God. Faith is not something that I come and say, I have faith. If you have genuine faith, you recognize it as a gift of God. So that when you come to recognize certain things, you say your reason is given to you by God. So you reason things out. And the church, because of the vast experience of hundreds of years, has developed a protocol, a word very common these days in the secular world, a protocol for dealing with what may seem to be possession. First of all, very few people are really possessed. There is a difference between diabolical possession and diabolical obsession. A lot of people become obsessed with the devil because they don't want to deal with the self. So everything they blame on Satan, Diabolical possession says, demonic possession, says that this human being created by God with a free will and whom God loves is now supposedly taken over by Satan. And when Satan says in the Gospels that talk about it, Jesus' own temptations, I will give you all these kingdoms because they have been given to me, that's a lie. God didn't give Satan any kingdoms. That's a lie. And when people try to say that God has given somebody over to Satan, that's a lie. Most of the time that's a lie, because God ain't giving nobody over to Satan. What kind of God can we believe in who says he loves us and yet says, So we have to understand that there's a discernment, and that's a very important word. There's discernment that takes place whenever somebody shows signs. Now, the signs in the culture that we have here in the Caribbean are usually very, very dramatic. But let's be clear about one thing. There are more people walking around in suit and tie and high heels and so on who are doing evil, and that is what the devil is about, right? Then there are people who are jumping up and, there are more demons in offices than in jab bands. I hope people get me right when I say this. So that said, when you have a case, the first thing that the church says, you do not label it until you have determined all the other possible causes. So that I, as a bishop, if somebody comes to me and the priest has prayed prayers with them and so on, you have the normal prayers that you say, right? As I say to people, if you're feeling some evil presence around you in the middle of the night, say the Our Father. Say the Our Father. Deliver us from evil. That's a prayer to God, and God hears that prayer. But when you meet cases where there's a persistence, that's the best word to use, a persistence in what one might term evil, and there are some signs, for instance, superhuman strength, speaking in foreign tongues that nobody understands, and that the person himself doesn't know, when people can see things which, like I as a priest, if somebody tells me somebody is possessed and they bring them in, one of the things that makes me think and think twice is if that person who I've never met is able to tell me things about myself.
Isn't that a gift? Isn't that considered a gift?
No, that's not a gift when it's coming from the evil one. And then, of course, where the devil is present, there is very often an incapacity to do good. So now when those things happen, the first thing is not to begin to say the devil here. You send somebody to a doctor to make sure that nothing is physically wrong. You send somebody to a psychiatrist or a psychologist who can do an evaluation to make sure that nothing is physically wrong. And then you proceed with the prayers. And the church is very strong that to do an exorcism where there is clear evidence that something is here that is super powerful, the priest must be somebody who is fasting, right? He must be absolutely clear about his own state of soul, right? And then you don't do this by yourself. You pray with the person and you invite other people to be with you while you're praying. You need that support, because when you read the stories about authentic possessions, you're talking about the devil in this person will pick up a priest and throw him across a room. And that's no joke. The church says, the Catholic Church says you do not do a real exorcism without the permission of the bishop. And why is that? Because the bishop then supports you in prayer, and the bishop knows there's no theatrics. Somebody who's doing an exorcism doesn't involve themselves in theatrics. I had a situation once where I wasn't a bishop yet. Somebody brought a young lady to me, and there was some things that you might call a possession. I wasn't sure myself. It seemed to me that she needed to go to hospital. It was a night when there was a curfew on, so I went to the police station to get permission to take this person to the hospital. The time I came back, 2 pastors were there, and they were, the family said they felt I was taking too long, so they said, and those guys were beating up this woman in her guts. Out of her, I say, out of her, get out of her, Satan, get out of her. Now, if that person is really possessed, they will feel nothing. That's one of the things that we know about authentic possession, right? That the exorcist, if he hits them in any way, for some reason, they have no recollection of it afterwards. But when the person is boiling out, that's a normal human being whom you are mistreating, abusing. So for the Catholic Church, this is not an easy thing. The world has gotten caught up and has made it look easy, and people want to say, yes, you have a devil. And let me say this very clearly. If any pastor says to you, you have a demon, and I want you to come back to be exorcised, bring $2,000 and 6 candles, you're dealing with a fraud.
When someone comes to you with that, and you know that, and you realize that they're disturbed, how do you handle it? You spoke about before, you would see them and then you would get a therapist, but if someone comes and they're trying to convince you that, hey, this is a situation, how do you handle it?
Well, it's simple, because I believe, to be very honest with you, before I attempt to pray with people, because everybody will give you a story, and before I attempt to pray with people, I will take the time to hear their story and ask them why they believe that this is the case. What is it that you are involved in? What is it that you are doing? For example, a lady came to me sometime. Her parents brought her. She was not behaving in a manner that you think a normal person would probably behave. And so they started sharing with me, and they believed that she was possessed. She has some evil spirit. They were shocked when I told them that your daughter is not possessed with a spirit, because I discovered that the young lady was studying and she had that kind of pressure on her. She was not eating properly and she was not having sufficient sleep. So I had to say to their mother, I prayed for your daughter, but your daughter is not demon possessed. Your daughter needs to get some supplement. She needs to take some time to rest and to look at her routine. It was difficult for them to accept that, because some of the things, it seemed as though she was talking very loudly, and she was not eating, and like she was afraid of a couple of things. Good for them though. They had some family member who was a medical doctor. Reluctantly, they left. I called the following day to find out how the young lady was doing, and the mother said to me, just hold the line. I will have a talk to you. And she was well, because when she went, a family member who is in the medical field diagnosed what the problem was. She got some supplement and she was back there. And so I, as a pastor myself, I try to work as close as possible with the medical person. So you have what you call referrals.
Have you ever had patients that you had to try to convince that it is in reality an illness, or you don't go that road? How do you handle it?
We say it all the while. Every day we walk, we try to let patients recognize that this is not this is an illness of the brain, and we have to recognize, just like we more willingly will accept things, like I said, we've been accustomed to, like heart attacks and strokes and diabetes and high blood pressure. These some people even accept the change in names and say, I am a diabetic, rather than. So this has been so over the years, and this is what we now face, having to tell. Persons are not deliberately told that you have a mental illness, but what we will show you is that if you came with hallucinations and disorganized behavior and disorganized speech and so on, once the changes have been made, so it is probably easier for someone to now accept that, well, this was afflicting me, and now I am free of the afflictions, and to square the circle and accept that the medication did help you, and if all you are treated with was the medication, then it's probably not so much a spiritual thing. Well, it's a circuitous route to get there, but we try to get there, and it's done each time the patient comes to the clinic, and what we also want to do is to get what we always try to do is to get the family members involved so they too can be more willing to see it for what it is and be readily and accept and encourage the patients then to conform and accept, take the medication, attend the clinics.
Define for me mental illness.
So mental illness is a group of diagnosable mental disorders. These disorders prevent a person from coping with their additional daily living activities. So it prevents you from your normal activities that you would do without fear, hindrance, or any kind of inhibition. Yes? So let's say, for example, every morning you normally get up and brush your teeth, bathe as normal. Anything that causes a pause in that normal thing that you do and makes you question it after you've been doing it for 20, 30 or 40 years, that too can be a symptom of mental illness. It sounds simple, right? But it's really not. These diseases are just like health disorders, except they're with the mind. So it's emotional disorder, it's cognitive disorder, it's psychological disorders, right? And all these disorders are treatable, right? So mental illness is not a disease where you die mentally ill, as most people think. Most of the illnesses are treatable, if not all. The patient has to be willing to do the treatment.
So it's anything that disrupts what we call normal behavior, anything that disrupts that, disrupts the normal everyday activities of the person, okay? That's how we would define mental illness.
What are the most prevalent mental illnesses you've come across in Grenada since you've been in the psychiatric unit?
We see all ranges of diagnoses from little one with ADHD. No, we do not treat them there. We see as the individual growth, maybe they have behavioral disorder, then we will get some mood disorder, psychotic illnesses, drug-induced illnesses, and later on in life we will have stuff like chronic cognitive disorder, dementia, and those are the ones we see. Some of all of those over the years.
Depression, anxiety issues, and yes, depression to also include bipolar and those kinds of situations, yeah. So those are the main ones I've come across. I dealt with a schizoid situation some years ago, schizophrenia, which is a kind of psychosis, which is a mental disorder, of course. And but that was a rare case, all right? And that's where the person loses, is totally disconnected from the realities of life, okay? So that's a serious mental disorder. It comes under psychosis. So I've dealt with that before, but I have not dealt with many of those. But it's basically depression, of course, suicide ideation, which is sort of connected to depression. So depression, suicide ideation, anxiety issues, and so on.
The fear of medication. Talk to me about that.
Well, I don't know what I can say about it because I say if let's say somebody is in the hospital with pneumonia or you have a serious pain, there's no qualms if the physician says, I want to give you an injection to ease the pain, or I want to give you an injection to ease this. I mean, medication by injection to ease this. So the fear of that, the fear is of the medication that is given by injection, and the trade name of this medication is Molicate. The fear is unwarranted. It is, if you read in the journals recently, sometime last year we had a CME and the physician, and these are people in North America and Canada who are saying that management of the schizophrenic is better, or the person who has schizophrenia shouldn't use the term schizophrenia. Management of these patients is better by this long-acting depot antipsychotic. Depot means it lasts for some time, just like the woman who is using contraception in the form of a depot, a pill, an injection that will last a period of time. So one of the side effects of these types of medication is that these types of antipsychotics broadly are typical or atypical. So the typical ones are the ones that have been around forever, and they may have these. Even the atypical ones, the newer ones, which have different kind of formulation, they still could present with that side effect, and the side effect that one may feel stiff, one may have a tremor. Right? So when this medication is given in conjunction with what they call an antidote, another type of medication which would delay or prevent those side effects that I just mentioned presenting itself. Now, patients are not just given medication willy-nilly. If you're going to be given this medication, you'll be given a small dose. You're in the hospital for a couple of weeks and you're not seeing 2 or 3 weeks. Then you get a small dose. So let's try him on it to see when he goes home if he could continue. So get a small dose and the person will see you get the medication, which is for the side effects every day. Once a day you get this medication and there's no side effect. Patients, because they are unwilling to have this medication at all, whether I give tablets or I give it by injection, nobody wants it because I'm not ill. And that's how it is. The patients will therefore go home with the medications and not take them. And so they may have this what they call pushing a wheelbarrow. The person seems stiff and hunching over, arm sweats at the elbow, and that sort of thing. That sort of presentation. And so that is what they present you in the beginning. They come with somebody who's been at home for a whole month for a shorter or longer period and disturbing the peace in the house, not sleeping, talking to themselves, and they finally come and they finally got enough to come, and then what they will say, don't give them the injection. But would you tell Dr. Noel not to give you an injection or Dr. Jagger not to give you? Because you want the medication to feel better, but you don't want to do what is right. And sometimes it's just selfishness on the part of the carer, family member, whoever is saying not to give.
I've heard about it since I was a child. Mm-hmm. Don't take the medication. Don't take the injection. Mm-hmm. You say it's unwarranted. Was there anything in the past that could have caused people to be so afraid of or distrusted?
I can't speak for the past, but it's the very same medication. I don't know if it was administered in any way differently, but times have changed, and we could see the majority of the patients who attend the hospital has this form of medication. And there'll be hundreds walking on the street whom you won't know because they are compliant and they comply appropriately. They have persons in their corners at home and in the community, and so trying to ensure that they remain well. Now, if the others who do not see themselves as needing the medication, they are the ones who say give the medication a bad name, so to speak. Yes, because people become aware that this person is on this medication and fun is made of the person, yeah? Because you're pushing a wheelbarrow kind of thing. So I can't speak about what would have happened, if anything, that would cause the mistrust. But the greatest thing is that they don't see it, it's not seen as an illness, and I'm not ill. So therefore, I do not want medication. I don't want to be in the hospital or in the C house or L house or M house, whatever house it is called. That is going to always be the case until the levels of education. You see, like now we talk about the COVID and you need to get 72% of the people vaccinated. You need to get the population aware, sufficiently educated that they could accept. Because each one of us, every moment of the day, we have some kind of mental issues with us. We feel sad when the news are bad. When the news is good, we happy. We have thoughts that are maybe terrible at some point in time in our lives. So it happens to every one of us. We get anxious in situations where an anxiety is probably warranted or is not even warranted, but we get anxious, and so we have to deal with it. So it's not anything that's running away or going to go away. If you have it, it's there, and any one of us can be so afflicted.
Okay. What has been the response from your patients regarding treatment, and if you need to send them on to a psychiatrist to get medication, so therapy and medication? What has been their response? Have they been welcoming? Have they fought it? How have they responded when you've done therapy with them and you say, hey, you need to continue therapy, or I need to refer you to a psychiatrist so you can get medication? What has been the response?
Okay, well, in terms of the schizophrenic patient I worked with, of course, with schizophrenia, that responds to both therapy and medication. So a therapist will have to work with a psychiatrist who is a medical doctor, as you know. So that because the psychiatrist is able to prescribe medication, all right? Psychotherapists cannot prescribe medication. It has to be a psychiatrist who's a medical doctor. So I walked along with a particular psychiatrist. I'm not going to call his name, but and the combination of the treatments, the therapy and the medication worked very well with that schizophrenic patient, to the point where even though there's the belief that schizophrenia cannot be completely cured, it can be managed, but I would say that this patient has been doing well for quite a number of years, and the schizoid situations bothered his life a lot. It made his life difficult to. It made it difficult for him to traverse, the normal living process. So
was he welcoming to medication and treatment and the therapy?
Yes. His family. I think one member of his family was initially against the medication side. That member of the family only wanted the therapy, but as we know, schizophrenia only responds to therapy and medication, a combination of both.
You talk about medication, and one family member was not in favor of it. Why do you think that in Grenada, well, we can talk about our society, many family members and even the patients are afraid of medication? Why do you think that is so?
You see, any medication, medication that's applied to a mental disorder usually has a stigma attached to it. All right. You see, whenever you say somebody is mentally ill in Grenada, the only thing that one thinks about is madness. That's the only thing that people think about, simply because they don't understand that there are lots of mental disorders, and a psychosis is just one of the many. Okay, depression is a mental disorder. There are much better drugs right now for different mental disorders available than in the past. All right. And these drugs don't have as many side effects as the old medications had. All right. Usually, when that medication was prescribed to patients in the past, I remember when I was a little boy, I remember that, even after the patient made a little progress, the patient was never himself or herself. They were almost, like zombified in a sense. They were never themselves. And the side effects were really harsh.
So that brings us back to the reason why many people are afraid to get medication.
Yes, because you still have that stigma attached, that those old outdated ideas about mental illness, about mental health, or mental disorder. I prefer to use the word mental disorder than mental illness. I think the word mental illness has too much of a strong negative impact, because of how it was used in the past, because in the past, if you said a person had a mental illness, the only thing you thought about was that person was crazy. And because we were not properly educated as to the types of mental disorders, we didn't have as many professionals to really educate the general public. There wasn't enough advocacy. People had a lot of misconceptions, a lot of wrong ideas about mental health and mental disorders. All right, but there are many different kinds of mental disorders, and I think because we have more professionals around now, there are more programs that are done for the general public, a lot more advocacy, and so on. Because I remember when I was a little boy growing up also, there was a psychotherapist called Dr. Mayhe. I don't know if you ever heard of him. Dr. Mayhe was the only psychologist / psychotherapist in Grenada. And if anybody, I remember when I was in school, if you just heard that a student was seeing Dr. Mayhe, that name Dr. Mayhe was like a bad pill, So, people kept away from that person, Dr. Mayhe, seen Dr. Mayhe, and Dr. Mayhe was like a frightening figure, simply because he dealt with mental disorders. But he was a doctor like anybody else.
Were there any students in your school who saw him?
Yes, I remember when I was for instance, when I was at the GBS as a student back then, you had students. I mean, when I was in school, students took their education very seriously, and they would do what we call beat the books, but there were some other students who would what we call use the word cram, so they would wait for the last minute and then cram everything, and then of course one or two of them ended up getting a mental breakdown, due to the stress of the studies and so on, and they would just get a mental breakdown. And a mental breakdown is no big deal. People talk about a mental breakdown these days as nothing. You get a mental breakdown, you treat it. Sometimes there isn't even any medication. You understand? It's just all therapy. And person recovers nicely and they go about their lives and normal lives after. But when I was a teenager in school, anything to do with mental disorders or psychiatrists or psychologists or counselors or anything, once you heard somebody was going to see such a person, you know, people backed off from that person, you know, and they didn't want to have anything to do with that person. Oh, he's a madman, he's crazy, those were the kinds of things that would have been said.
So did you want to be a frightening figure? That's why you became a psychotherapist?
No. You see, at that point, I wanted to be a medical doctor, not necessarily specializing in psychiatry. All right. I wanted to be a medical doctor. But I didn't want to do psychiatry, which is a specialty in medicine. All right. Because of what I was exposed to when I was growing up, you know, with mental disorders and persons who worked with people, you know, and we didn't even have a good mental facility in Grenada. We had that old mental hospital up at Richmond Hill. I don't know if you ever heard about it. It got bombed out during the invasion / intervention or whatever. You know, it was an old facility left by the French colonizers way back. You know, it was on the fort, you know, and the conditions were horrible. The patients were held in dungeons, you know, and these dungeons were used back then during the colonial period to house prisoners. All right. So and they looked very scary, you know. I remember because I played tennis back then at the Richmond Hill Club, which was just beneath the mental hospital above. There was Richmond Hill Tennis Club. And you'll be playing tennis and one of the mentally ill persons will be looking through those bars up there, you know, and saying all kinds of things, you know, and people would laugh and, you know, they would, you know, or some people would get scared and that kind of, so the whole atmosphere that surrounded mental disorders back then was not good at all.
What about, have you ever heard of the Mad Yard?
The
Mad Yard.
The Mad Yard?
Yes.
No. You mean in Grenada?
Yes. It was on the Carriacou. It was on the Carriacou. The French used to keep their soldiers there first. And then they brought them up to Richmond Hill. Yeah, right. That's what I learned doing all this research.
Yes. So a lot of people didn't know that the mental facility in where is it now? Tempe? Monge, right. The mental facility in Monge was not the original mental facility. You know, it was up at Richmond Hill. And the only reason it moved to Monge was because it got bombed out during the and that was a very sad period because a lot of the patients got killed. You know, I mean, the war actually exacerbated the mental conditions of a lot of them. You know, some of them ran out, and you know, they didn't even know what was happening or where they were going. You know, so a lot of people didn't know that there was that mental hospital or facility up at the hill at Richmond Hill, and so on. And even when we used to go up to play tennis, we used to be afraid to pass under that bridge close to, you know, because sometimes some of the patients would get out and they would be walking towards you and you would run, you know, as a little boy and so on. You know, you were just afraid of a mentally ill person, you know. That was like the worst situation. So nobody wanted to get into that situation. Nobody wanted to have such a person in a family or anything like that. It totally, you know, it was a really big stigma, you know. Separation anxiety is a mental disorder. Narcissism is a mental disorder, and the list goes on and on. All right, but the minute you say somebody has a mental disorder, the only thing that runs through people's minds is that person is mad or crazy or something like that. You know, so once the person gets a feeling that he or she has to be medicated, or to take medication for disorder, there's that stigma. Oh well, that person is psychotic or something like that, which is not the case at all.
According to my research, the French kept their mentally ill soldiers around this area of the Carriacou. It was called the Mad Yard. They then moved them up to Fort Matthew in 1880 to what was termed the Mad House. The facility continued to be in use at Fort Matthew to house local mentally ill patients until it was bombed in 1983.